Okay, we're going to try this again. So I'm out here just sharing some random thoughts. I've seen a number of patients who saw the initial video I did while I was at the training for Solomon's auricular allergy treatment training, as well as for the follow-on training to treat Lyme and chronic fatigue. And so I haven't had a chance to follow up with any of my experiences from that. It's been a pretty busy week in the clinic, and we've had a lot going on at the house for the last couple of weeks. So I'm multitasking right now and sharing the beautiful scenery of this nice cooler weather as we're just getting some exercise for my horse Red here. I promise he used to be Red when he got the nickname. So things that I've noticed in the 3 weeks since I had my needle in. The minor GI upset that I was starting to kind of correlate to certain mammal proteins, that is now completely gone. I've noticed that I have been sleeping better. I feel more rested in the mornings when I wake up. In the last 3 or 4 days, my metabolism has really kicked up. One of the things I've been struggling with in the last probably 6 months to 2 years, if I think about it, has been keeping my appetite at a normal level where I feel hungry when I should. I just really haven't been hungry, and that I don't think has been really ideal. I felt okay. I can't say I felt bad, but now that I'm starting to feel my normal hunger rhythms again, I would say that I'm definitely feeling better overall, more energy. So it's amazing how subtle just a low-grade allergic response can just kind of tap into your reserves, tap into your energy, and keep you from feeling your best. And this can be true not just for the alpha-gal sugar, but also for allergies to meats as a whole, or to dairy, or to wheat, or to tomatoes, or to all the corn and soy. We got a bunch of dust that's up in the air right now. They haven't brought the soy in yet, but a lot of the corn around us is coming in. And that creates an allergic reaction and irritates a lot of people. Sometimes we can manage it just by using things like nasal rinsing to keep the nasal passages cleaner, give the body less time to have that allergic response, and keep you feeling better. So some other things that I have discovered through this is that some of the allergic reactions have nothing to do with physical symptoms. I've had a couple of people who had sudden onset anxiety for really no particular reason, and started noticing some patterns with their food and their anxiety levels, and checked them for the alpha-gal, and sure enough, they were positive. And when we eliminated those mammal triggers, the anxiety was almost completely gone. In another case, the aha moment was that particular patient was not able to sleep. They were always waking up between 1 and 3 a.m. and very restless and agitated, and that 1 to 3 time period correlates with the activity of the liver in Chinese medicine. So it makes sense from that perspective that if you are having an allergic response, you're going to have a sleep disruption during that time period. We see that with other pathologies and patterns in Chinese medicine with different times where maybe sleep or energy or focus is disrupted depending on the corresponding organ system. So if you or someone you know has been dealing with these allergies and just really miserable, I encourage you to give us a call, come in and see us. Be more than happy to answer questions. And I hope you enjoyed this little lap around the pasture and the changing sky. And we'll talk to you soon. And give me some feedback. If you like this format, I can do more of these.